Go ahead and get started. If you guys want to get started, that'd be great.
Great. Do you want us to go ahead and share our screen, or will both groups introduce themselves to begin?
Maybe why don't we kind of have you guys both introduce yourself, and then we'll get you guys started. So welcome everybody to the Innovation Festival. We're so glad you guys made it. And I'll let the presenters introduce themselves.
That's great.
So I'm Dr. Jillian Chase, a PGY3 resident at Brown Women and Infants.
Hi, I'm Dr. Ellie Prusaloglu. I'm a PGY4 resident at Brown, and we're here with our mentor,
Dr. Carberry.
Hi, Cassie Carberry. I'm an associate professor of OB-GYN at Brown and the clerkship director and the beneficiary of these wonderful residents' innovation.
Hi, I'm Andrea Bodine. I'm at Berkshire Medical Center. I was the prior site clerkship director, and I'll let the others introduce themselves.
Hi everyone, my name is Brianna O'Donnell. I'm currently a general surgery preliminary resident, but I'm currently applying for the upcoming OB-GYN cycle.
And I'm Carl Hansen. I'm an MS4 who started this project in his third year, and I'm applying surgery this year, but I've kept this very close to my heart.
Wonderful. Is there any other administrative stuff, or should we go ahead and share our screen and do the first presentation?
Go ahead and share your screen. Thank you.
Great.
All right. So we'll go ahead and get started. So this idea came to us at sort of mid-pandemic. I'm planning on being a generalist, and Ellie is going into her breast fellowship next year. And we were both very involved in medical education, and specifically volunteering our time for grading the OSCE examinations for our medical students. And we noticed a particular need for further education for our medical students in the breast exam specifically. So we developed a module for our OB-GYN clerkships to supplement their education.
Exposure to breast health. In some centers across the country, it is incorporated into their general surgery rotation, and some students do have hands-on breast exam and breast surgery experience. But in most centers, including at Women and Infants, Brown University, most of their exposure is during students' OB-GYN clerkship, involved mostly in annual exams or in evaluations for mastitis in our emergency room. The way that our students' exposure during the COVID-19 pandemic's first initial rise was impacted is that their traditionally 6-week rotation in OB-GYN that included an entire week in the outpatient setting was trimmed to 4 weeks with a decrease in their outpatient exposure to a week of half-week sessions. In their training, they do get a formalized OSCE training session in the first week of their rotation. But this, unfortunately, from a breast exam perspective, traditionally only involved the 4 students in a room watching the preceptor do an exam on a standardized patient with no hands-on experience. They themselves only do hands-on practice with the pelvic exam.
So we sought to supplement our medical students' education by creating a toolkit for them to learn virtually on demand and covering sort of the broad general benign and malignant disease findings on the breast exam. We focused on making this video that was very applicable to students' OSCEs and shelf exams, while also hopefully becoming a resource throughout a student's medical education.
The video tutorial, which we'll show you a short snippet of in a little while, goes step by step through the entire clinical breast exam. It allows students a reference, not only for the actual steps of the exam and how to perform them in a technically correct and appropriate way, but also tips and tricks for arranging their exam, as well as reminders about things like patient modesty, comfort, and appropriate and neutral language.
We tried as best as possible to make this a very supplemental educational material while providing different angles of the video to be able to fully educate a student on what they might have missed while in the clinic or from their standardized patient exam.
In addition, we used several portions of the video, including a segment we'll show you momentarily, to highlight certain things that students might not find, even if their preceptors and their instructors in the clinical setting encourage them to do breast exams. For example, we included on the left here demonstration of what it might look like or feel like to have malignant findings or abnormal skin changes. And on the right, some examples of what might happen if you did an exam and expressed nipple discharge, as well as a brief overview of, the different types of discharge and what that might mean.
So for our students, the video is disseminated on the first day of their clerkships to all students. It's sort of packaged with other videos that have been compiled in the past on peritoneal repairs and vaginal deliveries. And we also offer any practice sessions in the sim lab for students who feel like they might need a little bit more extra hands-on practice.
Unfortunately, the COVID pandemic is trying to get in the way of that. We are going to attempt to successfully share the video here with you. Exam, we'd like to review the technique for proper breast examination. It is very important to not skip any areas on the breast. And so you want to use a lawnmower approach where you go up and down the breast, back and forth, ensuring that your fingers do not come up from the surface of the breast. Typically, the best way to do this is with 3 different levels of pressure: gentle, medium, and deep in a circular motion. You start at the upper inner quadrant and make your way down the breast, as so. As you can see in this demonstration, I'm taking care not to remove my fingers from the breast itself so as to not miss any potential small lesions. If I instead were to palpate, lift my fingers, and move, I could miss a lesion in between that area. Something else important to note is that when you are doing the exam, you should incorporate the nipple and areola into your exam as opposed to skipping over it. If Trying to get our presentation back. Let's see if you slideshow.
So we have several goals for the next step of our project. We hope to create some 5-minute virtual video reviews on high yield breast topics that might include more topics on what might appear on a shelf exam. We plan to review MS3 OSCE breast exam scores pre and post rollout of this virtual toolkit, and hopefully plan to expand our videos to our incoming interns who may also have lacked some clinical key experiences due to the COVID-19 pandemic.
The conclusions that we have drawn from this experience in trying to improve our breast education to students and colleagues alike is that training all providers in proficient breast exams will help provide more equitable access to breast care. Not everyone who sees this module or goes through our OB-GYN clerkship, pardon me, will become either an OBGYN or certainly not a breast surgeon. But we know that many patients, especially many of our young female patients, see limited providers during their healthcare journey when they're young and lack comorbidities. And so making sure that primary care physicians, OBGYNs, and specialists are all comfortable in providing a basic exam and understanding risk factors or abnormal findings to refer out should hopefully lead to a significantly improved quality of life and healthcare for our patients.
We thank you all for attending our presentation. We want to give a special thanks to Dr. Carberry for mentoring us through this project. And please don't hesitate to reach out to us via email. We'll put the link for the YouTube video in the chat, as well as their email addresses. We're happy to take any questions.
We will include the link here in the chat, and if there's any questions, we're happy to take them or to pass it on to the next team.
Hi, Elise Everett, that was great. Thank you for all your hard work. My question is one of the challenges we have is you teach them up front, and then they go out into the real world for 6 weeks and learn all these other ways and horrible habits from faculty, residents, nurse midwives, nurse practitioners, PAs, because there's not been any standardization of the exam prior to this. And then they come back into the OSCE and they get assessed on something that they haven't had the opportunity then to practice in 6 weeks. So I'm just curious how you might think about using this to overcome that challenge.
Yeah, I mean, that's a great question. One thing that I know we both personally have attempted to do and are hoping to make it more of a residency-wide focus is when we see our patients in the for annual exams in our resident clinic, to really refer back to this video, to ask the students to be looking at it before they go to do the exams, and to encourage them to actually do a side. Most patients, as we all know, are very willing to have learners in their care. And so I think if you present it up front to the patient and you say, we have to do a breast exam as part of your annual exam today, I do have Susie here with us, one of our medical students. Is it okay with you if I talk through what I'm doing on my side of the exam and, have my student, him or her, do the same on the other side? And then I'll usually kind of follow up with that. I've had all of my patients agree, and that's a nice way in the moment to say, oh, you're skipping areas on the breast. You are missing this abnormality. And so it's sort of real-time feedback, however limited.
I think my question is more to the fact that I think the faculty are not appropriately trained in how to do the exam. And I'm just curious if there's any opportunities there to really go back and retrain faculty.
I think that that's an excellent point. I think maybe one of the things that we could think about would be trying to share this module with our faculty members, but also possibly the grading rubric for what students are graded on, so that they know that they can't miss draping, because draping's worth 2 points. I think when I'm seeing students, especially like having graded these exams, I always say like, this is going to be on your OSCE, rather than actual like making a teaching point for educational purposes. I'm like making a teaching point to help them succeed because it's tied to a grading portion. But maybe that might be something that we could focus on doing, is sharing the grading rubric with our faculty.
And I will say long-term, one of my passions as an OBGYN resident and soon to be a breast surgeon is to actually help bridge that gap between the realms of being an OBGYN and a breast health practitioner, which I think oftentimes we all work in our silos. And so certainly if wherever I end up is interested in kind of expanding this teaching beyond just the med students and the residents to a faculty level, it's something I'm really passionate about and would be really excited to do sessions with them, especially if we had, standardized patients who could provide in-person feedback the same way that our students and our junior residents are given in-person feedback all the time. I think it's a great idea.
Ms. Morosky put like 6 questions in the chat. Would you like to address them?
Let's see. Just thinking, movie making. Have we submitted this to a film festival? We have not, but we could consider it.
That's a great question. We did not write a script for our movie. We filmed it on the fly. That's a good question. We tried to simulate as much as possible, like a real OSCE examination, with each other being the actors. And then the content, we tried to limit it to what would really be applicable to the OSCE examination itself, so that students could get the biggest reward for watching the video on their upcoming exams. But as we said, our next steps are hopefully to be more shelf examination focused.
Yeah, and just to jump off of what Dr. Chase just mentioned, some specific thoughts for the follow-up would be talking about genetic screening. So what are risk factors for patients that need to undergo genetic testing for high-risk breast mutations? We all know breast and gynecologic malignancy as a risk factor, but really understanding the role of prostate cancer, melanoma, as well as pancreatic cancer would be useful. And that, again, could be a video that could be targeted more towards residents and faculty members. A brief overview of, different breast cancer types, as well as treatment, which again could be targeted towards different groups, both sort of baseline knowledge for medical students doing their 3rd-year rotation, as well as more experts, at the residency stage and beyond.
I think somebody asked if the video was able to be shared. We would really love to share this video. It's on a free YouTube link, and we would love for you to share it with your medical students or interested parties.
That's where we need Helen to share the link in the chat.
I will try sending it one more time. I think it's at this link here. We can also work on trying to make it I think currently it's a private link, but we can work on making it a public link that if you just search it on YouTube, it would pop up as well. But that link should work. And please let us know if it doesn't, and we can make adjustments and send it back out. Thank you all so much for your attention.
Great, wonderful. Thank you so much. Great. And then if the next group wants to go ahead and start.
Presentation. Our presentation is entitled "To the Moon with a Slingshot: Low-Cost Simulations." So with APGO background and the low accessibility of our simulation lab, I'm going to put in a little plug. We used Dr. Everett was the first author on a paper that we used as a starting point of how to develop a simulation lab that would be able to really support all the needs of the students during their OB-GYN rotation. Initially this was scheduled as a trade show. We planned on having the entire lab around the table, our manuals, which are the self-instructed manuals available to visualize, and even available to download. And we had made a video last fall showing the development and the use of all of our models and the manual. So we thought it would be the best way to show the lab by showing the video. So the next 12 minutes are going to be the video. So enjoy the video.
This video will show how the simulation modules were constructed and their use. Included in this lab, we have a manual that is available in both physical and electronic copies. We also, behind me, can see our 11 simulation models. Each model has an entry in the manual. Together, they each create a module. We begin the manual with a table of contents which describes the order in which each of the modules occurs. And we follow that up with an introduction which provides for students an opportunity to understand how the manual has been assembled. There are materials within each module that will be described, along with goals and objectives of the simulation module, and instructions along with illustrations for them to use for guidance as necessary. The first 5 modules are based on gynecology skills development.
Our first simulation model is the speculum exam. There are 2 separate vaginal models. I am showing one here. There's a parus and a nulliparous model. The fabric was used to make the vaginal canal, and then the elastic was placed around the outer surface to form the introitus. The styrofoam ball was used for the cervix. One was made nulliparous, putting a just small opening with a pen, and then painted the pink-red paint to simulate a cervix. This was hot glued to the vaginal material, which was then placed within the tumbler. The tumbler was cut to the length of a speculum so that the cervix would be at the end of the speculum, and then a piece of rope was placed from the top of the introitus to the top of the tumbler for vaginal introital support.
And here we have our speculum exam. We've included a couple pages from the manual, and we've also shown a few of the speculum exam sampling supplies, which include cultures and vaginal sampling, along with various speculums. We'll take one, we'll pick it up. We'll look at our vaginal simulation itself, inserting our speculum, and looking down, we appear to have a parus cervix. I could also take some of the sampling supplies and take a sample for practice. The Foley and straight catheter module includes an entry in the manual which describes the normal female vulvar and perineal anatomy for students to better understand the anatomy that they will be dealing with as they place this Foley catheter. Our model seen here is prefabricated and bought from a company. On the back side of it, we have a bladder which can be instilled with some water. So we would have students draw up water and then instill it into the bladder. They then can take the provided catheter and practice with appropriate anatomical motions the mechanism of placing the catheter into the urethra.
Our next module is knot tying here in the simulation lab. We provided instructions for participants, but we also have 2 links if people are more visual learners. Here we are using a board that was provided to us by a surgical company, but one can be easily made at home just using a board and some pegs as well as some shoestring. Our next module is our suturing simulation. Here we are using a contraceptive implant device, and we're also using tools that were provided to us. And what we have here are a list of instructions as well as a link for our visual learners. So right now I'm just going to be putting in a simple interrupted suture, but students are going to be able to learn various different suturing closure techniques.
The pessary module, seen here, allows students to better understand the types of pessaries and their uses. We are allowing students through this module to visualize and feel the differences in flexibility that each pessary may have. The last 6 modules are based on obstetric skills development. Some of the modules utilize a baby doll, referred to as Baby Blue. The non-stress test module consists of an entry in the manual which describes the importance and the use for this test. We included a simulation which utilizes a website for students to practice interpreting these monitor strips, and we expect that students will be able to recognize basic fetal heart rate patterns on a non-stress test tracing. The Leopold's maneuver module has an entry in the manual which includes illustrations along with a description of the simulation. For students, the simulation is going to help them better understand fetal position in the uterus. We begin with students being able to palpate at the uterine fundus, down the sides, and at the maternal pelvic symphysis, all to try to determine in what position the baby is. At the end, we also determine the degree of descent. The baby can also be repositioned in different orientations for students to practice different fetal positions. The Cardinal Movements of Labor module includes illustrations from a major medical textbook, seen here, and we also have included Baby Blue to help students walk through the 8 different major movements that occur during the birthing process.
This is the cervical effacement and dilatation module. The models here were made using a softball and air drying clay to simulate the different dilatations and effacements. Then I used the sleeves off my white jackets and put rope through the cuff to form the vaginal introitus. I glued the sleeve to the softball and then glued the softball into the box. Packing materials were placed around the softballs to protect them within the box. The softball use with the air drying clay was first seen at a national conference simulation for OB-GYN, and I used that model to begin this module formation.
And here we have our 5 completed cervical dilatation and effacement models. Students are able to actually simulate placing their fingers into the vaginal introitus in order to feel different phases of cervical dilatation and effacement. The fetal head presentation module consists of entries in the manual which include illustrations from major medical textbooks, along with our actual simulation model, which is baby blue again. We have taken baby blue and using a wood burner have engraved both a posterior fontanelle, which is triangle, and an anterior fontanelle, which is diamond. We've also taken the time to engrave the suture lines so that students can use these to physically palpate the suture lines as they try to determine the different presentations that baby blue could take during the process of birth. The fetal head diameter module includes baby blue again for demonstration. In this module, we have included baby blue as the model with a couple lines drawn on his head, one in red and one in black. The red represents baby blue's head in extension, and the black one represents baby blue's head in flexion. This helps students to visualize the difference in head diameter that occurs as baby blue passes through the pelvis in an extended versus flexed position. To accomplish this, we took a rubber band and a couple different colors of permanent marker to trace the different diameters onto baby blue's head. And for the manual, we included a couple illustrations from a major medical textbook so students could get exposure in different ways.
Perfect. So now that we've showed you guys everything that we developed, what we're doing currently is implementing this into the OB/GYN clerkship. And how we're doing this is we're evaluating the students through a pre-test survey that they'll take before their rotation, a survey that they take while they're doing their rotation and have done the simulation lab, and one that they take afterwards. And our goals are to see how having all of these simulations help them during their clerkship year. Do you guys have any questions or concerns?
I think there's a lot of kudos in the chat about how comprehensive and impressive this is, especially when there are not as many resources available. And so I think, are you having students just go through these on their own time then?
Yes, yes.
Just throughout the clerkship they come, it's just available like during business hours or 24 hours?
Yeah, so we have a couple options. So the library itself is open 7 to 3 each day, Monday through Friday. So if they want to physically do the parts that require them to be here, it's between those hours. But we do have copies of our manual, which they can read outside of business hours, available online. And a couple USB drives that they can also take out of the library and look at their discretion.
And do you guys have a sense of how much have the students been taking advantage of this?
Yeah, so I actually, where I'm here for the year, what I do is I let them know at the beginning of the rotation that they have this at their service whenever they want to use it. And I've just kind of stayed in communication with them. And a lot of them have reached out to me afterwards, letting me know that they found it really beneficial.
There's a question in the chat about one question about, do you have associated cases with them? In other words, like, do you have a little case scenario? And then there's a second question around assessment. Like, do you have some self-assessment that they do or a checklist that they do in some of them? Or is there ever a time where they might have an observation done?
Yeah, so in the simulation lab manual itself, there are defined objectives for the students so that they kind of know what they're going through. We don't have specific cases yet, although that's a really good idea and maybe a next step that we could look into. And the post survey that the students take, we ask them, you know, do you feel comfortable now doing a speculum exam? Do you feel comfortable inserting a Foley catheter, knowing that they may have not necessarily done it on their rotation, or sometimes they have. And we haven't looked at those comments yet because we're waiting till the end of the year, but hopefully they will say that they feel more confident with these.
Can you give us a sense of how much time it took to create all of these resources?
Well,
More time than money.
Yeah. So it
Time is money.
Yeah, exactly. Right. Right.
Yes.
Well, yeah. So I actually paid to do this, I guess, is the good way to put it. So the actual creation of the lab, I would say
And the manual.
40 hours,
Probably.
40 hours total. The amount of time to make that video, probably another 15 to 20 hours. So the overall time investment across the year is very small. So it is something that you can sort of pluck away at. We sort of did it in a bunch of little chunks, and so we created it pretty quickly. And so there's definitely some room that we can move forward, add some more modules. Who knows?
I can just offer just a few tips. One is we've used our OB-GYN student interest group to create models like this. So for our boot camp, when I have to make 70 cesarean section abdominal walls, I just bring the OB-GYN SIG group over to my house and I supply drinks and food, and then they build the modules and they actually learn the layers of the abdomen by doing that. So I found that's a great way to get people to build modules for you.
Yep.
The other technique that we've used is to make like 3 or 4 sets of everything, and then students can check them out, if you will, and take them home and then bring them back. And it's sort of a professional honor code in terms of you know, not walking off with like a copy of the textbook kind of thing. And those are just a few. I've had one other thing, but it's now escaped me. So if I think of it, I'll put it in the chat.
Cool. Thank you.
And there was one other question in the chat about who's maintaining the materials.
Okay. So right now, obviously with Brianna here and then with Dr. Bodine, they're both in the immediate vicinity. And so we have access to the library, so we can keep an eye on it. We just took a look actually at our cervical dilatation and effacement modules today and had to fix a few things here and there. But it's something where, you know, it sits in the library, and so the librarians are just outside the door from us. And if a student finds a problem, the librarians are very good about letting us know if something comes up, because we're not here every week checking to make sure that everything is going the way that it is. Because we try to be as hands-off and let the students really do their own self-directed learning.
So we
I
hope
put my
people
comments in
gain
the chat.
what? Her comments in the chat.
Oh, yeah.
Great thing just signed during COVID times.
Right, exactly. Yeah.
And our hope is that in this presentation, people have gained some ideas to add to their own simulations.
Yeah. Because this being from a small community, you know, hospital, this really, I think, speaks to those small underserved community hospitals that don't have the, you know, $10, $15, $50,000 to spend on simulation. And this, while it's not perfect, is a step in the right direction to get people at least more comfortable working with different things. The other thing, I put in the chat our link to the video. You should be able to access it. If not, in our bios, the link is also there. And I promise you, it plays better than it plays across Zoom. So there's that. Yeah.
Yeah, at least that will be the next project with the next students, is to make more sets so that we can give them away.
So, but I know we're running close on time, so I just want to thank everyone for coming. We weren't sure exactly what the turnout would be, and I'm very impressed and very appreciative as well.
And great job to the breast module as well. That was really great.
Oh, absolutely.
It was what we're missing.
Kudos, we have to collaborate.
Yes, please.
Great. Well,
Yes,
thank
we
you
did.
guys. Oh, sorry. Go ahead, Andrea.
We didn't have breast in ours. It was one thing I couldn't quite figure out what to put in and how to do it. So that would be a great thing to add in. And my question would be, what did you use for your little simulation model?
I'm
To be
thinking
honest-
balloons, Play-Doh.
I was gonna say you could do a balloon. I don't know about with water, but you could fill it with something.
That wouldn't be great.
Ours is a model that was purchased for a simulation lab, but your presentation got our wheels turning, trying to think how could we create additional models. Certainly orange peel for pot orange, like Dr. Everett just mentioned in the chat, is a great idea.
Well, our self-instructed manual is available as one of the handouts. And like I said, like Carl said, you should be able to get a copy of the video.
Great, thank you, everybody.
With sand, balloons are great. You can make anything with balloons because you can get the long skinny balloons. And so I've done like long skinny balloons that are filled with red food coloring, blue food coloring, yellow food coloring for urine, blood, venous blood, arterial blood. And they also are great for like making tissue type things. So I, pink balloons with Play-Doh in them for a uterus. So balloons and Play-Doh or sand are, or water with food coloring are all great, easy, cheap things to do.
The only problem with balloons is they're latex. And when they pop, people with a latex allergy can have a reaction. So have to be sensitive to that in some situations. The balloons with the sand.
Yeah. And I know that we probably there's just the two groups in this particular session. So
yeah, it's just the two groups, and we're going till 4:15, so we have plenty of time.
So that's fine. Yeah. So we've sort of hit our mark at least. So the next question that I was going to have is, while we have the time, and with understanding the video is what it is in this setting, were there any of the models that you had seen that you wanted to see again or see closer? Because we have everything behind us too. I wanted to at least put that out there in case somebody was looking to see something in particular. And it's okay if not.
Do you think you'd be able to show us what the cervix looks like with the speculum exam?
Wait, I may be able to pull that off. You give me a minute or two, we can see if I can do that.
I realize the lighting might be an issue, but I was curious about that.
Yeah, we stopped and restarted the video to get that view of the inside of the cervix. So we have both a paris and an oviparous, and we showed the paris cervix. You have to put the...
Yeah, we'll see if we can.
We're getting it.
Let's see if we can.
Do you want to put the speculum?
Yeah, we should put the speculum in. Yeah, I can be our light person.
Okay.
At the very least.
And show them, if you can, show them while you're doing it. Here. Okay. Here you go. No, there we go. Can you see it at all? So
yes, yeah. That was very helpful.
The funny story is I went to Joanne Fabrics to get the pink fabric, and I wanted something stretchy, and I'm thinking, how much do I need, and on and on, and I get to the clerk to have her cut off my piece, and I said, I think I need 1/4 of a yard, and she says, well, what are you making? And I paused and thought, does she really want to know? And I said, a vagina. She will never ask that question again.
That is the greatest story I think I've ever heard.
It is funny.
Ask and you shall hear.
Were there any things that you guys tried and failed so that we don't make the same mistakes?
The clay on the softballs. We bought 3 different drying clays before we found one that worked. And can I say the name of it on this video or on this presentation?
Yes.
Okay, it was the Crayola air drying clay. so we used that, and the only tumblers I found that were the right diameter to put the speculum in that styrofoam ball in were the ones that were a little too long. And then we realized that we couldn't keep the cervix where it needed to be. So we marked it where the end of the styrofoam ball was, and had someone cut it off for us. So we had to be creative all the way.
So for instance, with our cervical dilatation effacement model, so it's essentially, yeah, so it's just a little like cover lid, hot glued on top of the softball with the sleeve over it, right? So,
oh
yeah. So taking down the false vaginal canal, you can see that the drying clay, we were able to sort of fashion it so that we can make it as thick or as thin, as dilated or effaced as we really want it to be. And with some practice and trial and error, I think it turned out really good.
It was fun to do.
Yeah.
Carl and I spent a lot of evenings together.
Yep.
Yeah, perfect.
Great. Any other questions from the audience? All right, I apologize for my dog's emesis, but thank you guys